The third part of this presentation outlines how the Stroke Rehab App will work to extend the excellent stroke care services offered by some metropolitan and regional hospitals into metropolitan, regional and rural communities throughout Australia. It also outlines how members of various stakeholder groups may benefit from the development and use of the Stroke Rehab App. It is envisaged that the Stroke Rehab project will work in the following way. When stroke survivors are discharged from hospital, they or their carer will be issued with an Apple iPad containing a specially designed Stroke Rehab app. The cost of the iPad will be in the order of $900. The stroke survivor will be signed up for an NBN account with an appropriate ISP, and they will receive basic training on the use of the iPad and the Stroke Rehab app. The Stroke Rehab app will contain a summary of the stroke survivor's medical records from the discharging hospital. This will be limited to medical information that is considered by the discharging hospital to be relevant to the ongoing treatment of the stroke survivor in a community setting. Throughout the course of the stroke survivor's treatment in the community, some of this medical information will obviously be updated, and it will be necessary for some of that information to be periodically synchronised with the medical records held by the discharging hospital, the stroke survivor's GP, and any relevant community health professional. How this aspect of the project will work with any future e-health initiatives will need to be worked out later. The Stroke Rehab app will also contain a full assessment of the physical, mental and cognitive disabilities of the stroke survivor as determined by the discharging medical officer. This assessment will be based on the ICF scheme, or International Classification for Functioning, Disability and Health, and will serve as the baseline for the measurement of progress of stroke rehabilitation. The Stroke Rehab app will also contain a range of national, state, regional and local stroke recovery information sourced from organisations such as the National Stroke Foundation, state-based stroke associations and community-based stroke support groups. This could include links to websites, reports, lectures, book reviews, e-books, podcasts, vodcasts, and even movie clips. The Stroke Rehab app will contain information about available stroke services. This could include descriptions of services available within the actual community in which the stroke survivor lives, and could cover all aspects of the stroke recovery journey. This service provider information could include contact details, public transport details, street maps, and so on. And finally, there may be several versions of the Stroke Rehab app that run on iPads or conventional desktop or notebook computers, to provide different stakeholders with appropriate access to stroke rehabilitation data. The Stroke Rehab App will also contain a selection of specially designed and encoded evidence-based therapy programs that can be followed by the stroke survivor once they get home, with or without the assistance of their carer. Over time, a wide range of programs could be developed in areas such as physiotherapy, occupational therapy, psychology, speech therapy, health, diet, and fitness. The Stroke Rehab App should also contain a comprehensive, evidence-based self-management program for stroke survivors. It should also contain tools that give access to stroke forums and special interest groups. Each therapy program supported by the app may contain a number of mandatory or optional exercises, and each program or exercise may be supported by audio and or video clips or short YouTube videos that demonstrate how each exercise should be performed. The Stroke Rehab App will prompt the stroke survivor to perform program exercises according to a schedule defined by the prescribing therapist. The app will be able to record audio and or video clips of the stroke survivor performing those exercises. The app will be able to send audio and or video clips back to the prescribing therapist for evaluation and comment. The app will also contain simple questionnaires that can be used to periodically assess changes in known functional and emotional disabilities. The Stroke Rehab App will record information about the performance of various exercises prescribed by one or more therapists. It may then periodically send that performance information back to the relevant prescribing therapist and, if necessary, be able to update the stroke survivor's medical record in both the discharging hospital and the medical records held by the prescribing therapist and or the stroke survivor's GP. The prescribing therapist may then remotely review any audio or video feedback from the stroke survivor and then modify the therapy programs or the exercise schedule, prescribe alternative therapy programs, transfer the care of the stroke survivor to an appropriate community-based therapist, general practitioner or case manager, schedule a video call with the stroke survivor or carer to discuss progress and give encouragement, or make an appointment for the stroke survivor to visit the therapist in a regional or metropolitan hospital. The Stroke Rehab App will accumulate program performance information which can be reported to a central database and can be used by therapists and research workers to accumulate evidence of the cost effectiveness of various programs, to build evidence-based cases for the funding of various programs, to assess the ability of therapists to prescribe and deliver effective programs, and to identify locations that are underserviced by therapists or where therapists lack the skills to deliver effective programs. The Stroke Rehab App will enable hospitals to discharge stroke survivors earlier than usual in the knowledge that they can continue their rehabilitation at home, yet have immediate access to specialist therapists if needed. To lower the rate of readmission of stroke survivors, to lower the rate of recurrent strokes, and to lower the number of outpatient appointments with stroke survivors. The Stroke Rehab App will enable specialist stroke therapists to better follow the progress of stroke survivors of special interest to them, to introduce stroke survivors to appropriate new techniques and programs long after they have been discharged from hospital, and to transfer their stroke-related skills and experience to community-based therapists. The Stroke Rehab App will enable medical researchers to get better information about the effectiveness of particular programs, to more easily recruit stroke survivors into case studies to evaluate new or improved programs, and to get better information for the preparation of research grants. A Stroke Liaison Officer version of the Stroke Rehab App could help those officers to establish and maintain phone, email and/or video contact with stroke survivors and carers living in the areas for which they are responsible, to monitor the progress and evolving needs of stroke survivors and their carers, particularly during the early months after their discharge from hospital, to refer stroke survivors to relevant allied health and community services and programs offered by local service providers, to provide relevant stroke recovery and rehabilitation information from national, state, regional or community-based sources, and to provide tools for managing their contact lists, workloads and reporting requirements. A Stroke Clinical Network version of the Stroke Rehab App would help those networks to better monitor the use of clinically effective, evidence-based stroke care services in communities across Australia, to better monitor the clinical standards in stroke care services throughout Australia, and to better engage clinicians in discussions about stroke care policy and delivery. The Stroke Rehab App will enable politicians to obtain better information about the cost effectiveness of particular medical programs. to better identify service deficiencies in their electorates, to demonstrate the benefits of having NBN services in their electorates, particularly for regional and rural electorates, and to reduce the massive burden of disease associated with stroke. The Stroke Rehab App will also enable stroke survivors to take better control of their own recovery while living in their own homes and communities. They will be able to use various apps in addition to the Stroke Rehab App to access information that stimulates their minds and opens new avenues to rebuild their post-stroke lives. And they will be able to get access to information, products and services that will help them re-engage with their communities. To summarise this section so far, I have briefly outlined how the Stroke Rehab App will work. By having selected stroke survivors issued with an Apple iPad loaded with a special Stroke Rehab App and containing a wide range of national, state, regional and local stroke recovery information. The app will support a wide range of therapy programs that have been specially designed to be performed at home and which provide for video feedback between survivor and therapist if needed. The app will support the measuring and reporting of the stroke survivor's performance on these programs to the prescribing therapists and will allow therapists to modify programs remotely based on the survivor's progress. I have also briefly outlined how the Stroke Rehab App will help members of various stakeholder groups, including hospitals, who should be able to discharge stroke survivors earlier in the knowledge that necessary therapies are being continued at home. Therapists who will be better able to share stroke care knowledge and experience with their colleagues. Research workers who will have more reliable information on which to base stroke research grants. Improving the effectiveness of stroke liaison officers and stroke clinical networks. Politicians who will have access to more reliable information they can use to lobby for better services in their electorates. And stroke survivors and carers who will be in a far better position to rebuild their post-stroke lives and gain an acceptable quality of life, no matter whether they live in metropolitan, regional or rural areas.